Hello everyone, you're welcome again to Essential Health Higher Institute podcast. And today on the program we have as guest Dr.Kimonia Awanchiri Bir, who is a physician and a specialist in emergency medicine. She also teaches in training institutions, and we have been doing a lot of work as far as emergency and critical care is concerned in the royal communities. But today we are not talking about emergency and critical care. We are talking about hypertension. So, Dr. Kimonia, you are welcome to the program.
Thank you very much. In simple terms, hypertension is sustained raised blood pressure, and this raised blood pressure, you have to put a number to it. It is if your blood pressure is above 130/80. That's the most recent definition. Initially it used to be 140/90, but right now we are concerned if your blood pressure is above 130/80.
Thank you so much. And she emphasizes sustained elevation in the blood pressure with those values that she has mentioned. We have to really be able to watch out about hypertension. So, but people may want to know from you, when we talk about hypertension, commonly in the community they sometimes call it high blood, but they don't seem to really understand the magnitude of this problem. How can we measure the magnitude of this problem? How is this really an issue in our communities? This may be one of the things that the people want to hear, so that they can know if they need to check their blood pressure.
Yeah, so that's a very good question, because hypertension, which is raised blood pressure, abnormally raised blood pressure, is more common than we think. So according to the World Health Organization, about 1.3 billion people in the world are affected by hypertension, which is a really, really big number. And guess what? A bigger proportion of this number are Africans. About 2/3 of that, that number are Africans, and that's only for the ones that we have reported. So specifically in Cameroon, a very recent study showed that there is really wide variation of the percentage of people who are affected by hypertension, from as low as about 5% to as high as about 35%. And it's people living in urban settings that are more affected by hypertension.
Thank you so much. This really can be a serious problem now in Africa and in our communities in Cameroon and other parts of Africa, particularly as the economic situation of most African countries is changing, and also the urbanization is growing. And this may also be a serious issue, considering the fact that maybe people do not yet consider this as a problem, and so do not even check, do not even measure. So I think one of the most important things that we are keen to know from Dr. Kimonia again is to tell us, how do we diagnose hypertension?
All right, that's a very important question, because statistics again show that about half of the people who have hypertension don't even know that they are hypertensive. And that's a very, very big problem. So you may be asking, why do they not know they're hypertensive? I mean, if they are ill, why would they not know they are ill? That's simply because hypertension, unfortunately, oftentimes will not show any signs and symptoms until it becomes complicated. That's what we'll see the complications of hypertension a little later. But a hypertension without complication, you wouldn't have any signs and symptoms. That's why the best way to diagnose it is just to do a screening, and that includes doing our routine blood pressure measurements. And for people without risk factors, it's advised to just check your blood pressure about once a year. But for people who have other risk factors and maybe they have slightly raised blood pressure, it's important to check at least twice a year.
Okay, thank you so much. And you have made mention of how we can check our blood pressures and others. But I believe that besides measuring our blood pressure in our routine checks, if we have the risk or not, there might be other findings that you may advise that people can check. Are there other exams that may be done in order to support this check in blood pressure, or maybe it's related to the risk?
Yeah, of course. So talking about risk, I'm sure that some people will be wondering why they probably have hypertension and maybe they are not overweight, So there are several risk factors associated with hypertension, and some of them you can control them and others you cannot. So some of the things that we cannot really control are things like family history of hypertension, our genetics, and the things that we can actually control that are risk factors for hypertension. They don't necessarily cause, it's not like there's that one cause for hypertension, but a combination of things can predispose us to hypertension. We have things like being overweight, smoking, excessive alcohol intake, a sedentary lifestyle, lack of physical activity, and stress. Stress is also very, very important. Now, the other predisposing factors to hypertension, which brings us to maybe the types of hypertension, because with hypertension we have primary hypertension or secondary. So primary hypertension is just like hypertension, which is just raised blood pressure and it's just at the level of the blood vessels, but secondary hypertension is when this raised blood pressure is caused by another disease that you have in your body. So it's secondary to this other disease, and some of these diseases are things like obstructive sleep apnea. I say that first because it's very common, but people are not aware of it. So things like having problems with breathing when you sleep is a very big cause of secondary hypertension, and things like problems with some of our problems in our endocrine system, like thyroid disease, Cushing's syndrome, other things like kidney disease can actually cause hypertension. And in this case, when you're treating this hypertension and you know that this is the cause, you need to also treat the underlying disease to be able to have like a good outcome.
Okay, thank you again for this detailed explanation, particularly about the types of hypertension and also the fact that you have emphasized on what really causes hypertension. And people may really be surprised to know that just the fact that you are not drinking enough water, and then you maybe develop some kidney problems, and then it can cause hypertension. And it means, though you have said there are some predisposing factors like the common ones that we know, but there may be others like what really can cause, like what we've just cited and things like that. So it means that besides, we should still be able to take care of other aspects of our health, even if we are able to control the other predisposing factors like obesity and so on and so forth. So this is very, very important for our people to know, and we are also very, very keen again for you to tell us there may be some consequences when you get hypertension, maybe because of other reasons. It may lead to other problems, just as you have said, other problems can lead to hypertension. So I think also maybe hypertension can lead to other problems. So can you tell us something like the complications of hypertension?
Yes, I really like this part because that's exactly why we educate people about hypertension. Because like I said earlier, if you just have like a simple primary hypertension, you will not have any signs and symptoms, and you probably think that there's no need to even get checked, and you think that there's no need to take medication, but that's not our problem. Our problem is the complications of hypertension, and by complications I mean the things that hypertension causes in your body, the problems that hypertension will cause to the other organs in your body. And the number one is like your heart. Hypertension can lead to things like heart disease. It can make your heart to become bigger, it can make your heart to start beating faster, it can make you to have a heart attack. You start having pain in your chest. That's why it's people with complications in hypertension that start having signs and symptoms. For example, if you're having a heart disease, you can start feeling palpitations, you can start feeling some chest pain and all of that. That's now when complications are already setting in. The other common complication of hypertension is stroke, which is a very, very big problem in our communities. Even in the hospitals, you find very many people lying in the beds due to stroke, and when you find out, you see that they had hypertension that was not being managed. So stroke is a big complication of hypertension, and it's something that we can definitely prevent if we can, diagnose the hypertension early and take our medication. Another common complication is kidney disease. So if you have sustained blood pressure and you are not managing it, you're not doing anything to bring it down, you begin to, subject the kidney to that high pressure in your blood, and that kind of pressure overworks the kidneys and it tends to cause chronic kidney disease. Yeah, so those are some of the complications.
This is so important for our people to know that hypertension can really lead to a lot of problems, a lot of complications, other diseases. And sometimes this, what you just said, it came to my mind that when you listen sometimes in the radio announcements, when they're announcing the death of people, particularly really those important people in our society, in our urban area, those people really, those strong statesmen, you will just hear died of a brief illness. So it may be that heart attack, maybe the cardiac arrest that had resulted death, maybe from as a complication of hypertension. So this is really an important information for us to know that we have to diagnose hypertension early and then take our drugs as it has been prescribed, so that we do not get into these complications and lose a lot of valuable people in our society or in our community. So this now takes us really very importantly to ask from Dr. Kimonia now. Can you then tell us, how do we manage, how do we treat hypertension?
Okay. Before we go to that, I'd like to maybe talk a bit about diagnosing hypertension, right? We have spoken about the fact that you may not show any signs and symptoms, yes, but then we need to check our blood pressures, and this especially for the health workers. It's very important for us to know how exactly we have to measure our client's blood pressure. We have to know the right way to measure the blood pressure and how frequently we need to measure it, right? So most times we don't take a blood pressure once and conclude that somebody has hypertension. So except in scenarios where they already have a complication, like if they have severe hypertension, like the blood pressure is over 180 over 90, for example, that's getting into like a hypertensive urgency or emergency depending on what's happening to our organs, right? But then the first thing is that you need to know how to take the blood pressure adequately. So I'm just going to walk us through a simple scenario. If you go to check your blood pressure, of course you're supposed to rest for a few minutes before you do that, and maybe in the hour before you measure your blood pressure, you can avoid things that can stimulate you, like exercise. You can avoid caffeine, you can avoid things like exercise and caffeine. Then after resting, it's important that you should take off any clothes that may disturb the blood pressure reading, because sometimes I've seen where I need to measure somebody's blood pressure and they're like, oh, just put it on my shirt, but it's best to take it off so that we have the most accurate reading. And when we are doing that, we have to ensure that the blood pressure device that we are using, which is usually the device, let's make sure that the device is working appropriately, and we need to make sure that the cuff is the right size for the person whom we're measuring the blood pressure, right? Because it could be much bigger or it could be much smaller. So those are the things that we really must pay attention to, so that we don't give somebody wrong information. And during the blood pressure reading, again, you have to ensure that nobody's talking, especially the person whose blood pressure is being measured. They're not supposed to talk. And it's important, especially for the first time, to measure the blood pressure from both hands, both the right and the left. Now, if the blood pressure is high but not severely high, you must recheck this blood pressure. But in that moment, at least 5 minutes after, and then you call this person for another session. Usually we recommend that before you diagnose somebody with hypertension the very first time, within a week, you measure their blood pressure 3 different times on 3 different occasions, right? And ensure that it's consistently high. And why is that? It's because there are several things that can cause somebody's blood pressure to rise at a certain instance, like they may have received bad news, or maybe their bladder was really full and they were not able to go to the toilet to empty their bladder right before the blood pressure reading. So that's why we ask patients to come back after a few days so that we can recheck the blood pressure and confirm that it's high. before we decide the treatment plan. Yeah.
Okay, thank you so much. And in terms of the treatment plan, I know just we cannot go into details of treatment, but maybe you might want to tell us, when we say that we're treating somebody for hypertension, what is really the strategy for treatment?
All right. So I like your question about strategy, because we must be very strategical. That's why it's important for everybody to go to the hospital, because treatment is tailored to each individual, and it depends on many factors like their race. Of course, we are black, so they are the most common medication that we use, and then things like the age, and then most importantly things like other comorbidities. That means other diseases that the patient may have. So a patient with hypertension without kidney disease, the treatment will be slightly different from somebody who has hypertension and kidney disease, and you'll also be slightly different from someone who has hypertension and heart disease. You get it. So that's why in the evaluation of people with hypertension, we need to check whether they have these other diseases. That's why if you come to the hospital, we'll say you need to do tests on your heart, you need to do a kidney test, and all of that is simply because we need to ensure that these other diseases are present or absent, so that we can tailor the treatment. Now, for treatment, it's usually stepwise. If the blood pressure is not very high, we prefer to start with lifestyle modification, which includes the fact that we are going to counsel the patient about many things, including their diet, including the fact that if they smoke, they need to stop smoking. If they take a lot of alcohol, they'll need to reduce it and possibly eventually stop. Things like trying to avoid stressors, the stressors in their life, and and how to actually just know how to monitor their blood pressure. And then things like salt in the diet. Salt in the diet is one of the single important risk factors of hypertension when it comes to our diet, the amount of salt that we have in our diet. So that's the first step. Many patients with like mild to moderate hypertension, we just put them on lifestyle modification, and then importantly we need to follow them up. So after the follow-up, if your blood pressure is not being controlled, meaning that the blood pressure isn't coming down, we need to start you on medication. And I already explained that the medication that we'll put you on will depend on if you have other comorbidities. But to just give a brief, the three most common medications we use to treat hypertensive patients in our setting, we have calcium channel blockers like amlodipine. So what it simply means is that it blocks calcium in our blood vessels, and when it blocks the release of calcium, it reduces how much the blood vessel is constricting. So it causes some kind of relaxation in the blood vessels, so it reduces the blood pressure that way, right? Another medication is angiotensin converting enzyme like lisinopril, and lisinopril works by inhibiting the conversion of angiotensin 1 to angiotensin 2, and when you inhibit that conversion, you reduce the constriction in the blood vessels, so you make the blood vessels to kind of like relax and dilate, so you kind of like reduce the pressure on the blood vessels. And another common medication is diuretics. So what diuretics do is that it causes you to excrete more water and salt from your body. So when you reduce the volume of blood, it helps also to reduce your blood pressure. And I'm explaining that because that's the reason why you see sometimes we put some patients on 2 or 3 different medications, because they all act differently and contribute to reducing the blood pressure.
Okay, thank you so much. As you have said, from lifestyle modifications to use of drugs in the management of hypertension, and you have said that sometimes we have to place these patients on treatment until when it is the doctor that decides if the patient can stop the treatment or not, because you cannot take, when your blood pressure is under control, you can't say you have been treated already from hypertension. This can be very challenging when somebody has to take drugs for a long period of time, say for life. So what may be the challenges maybe associated with this kind of treatment?
So there are very many challenges faced with managing hypertension, and it can be really challenging because it's a chronic disease, and like you rightly said, somebody has to be on medication for a very long time oftentimes throughout their lives. What usually changes maybe is the dose and the number of the different types of medication. It can increase from 1 to 2 to 3, or it can decrease, but usually they have to take it chronically because it's a chronic disease. So one of the major challenges in our setting is socio-demographics, right? So let's talk about the fact that some people don't even have access to these medications, or they don't have access to the right medication that they should be taking. Things like poverty leads to people not being able to buy their medication, which is really a challenge in our setting. The second thing that is challenging is the fact that diagnosing the secondary cause of hypertension in people who actually have secondary hypertension can be difficult. Some people don't have the finance to be able to do all the investigations that we need to be able to diagnose if there is a secondary, if there is something that's actually causing the hypertension. So you find someone just on antihypertensives, but if they actually have secondary hypertension, it's important for us to find out the underlying cause and also put them on treatment for this underlying disease. Another thing that is difficult is adherence. So for people who have everything, are able to fund taking care of themselves, they're able to buy their medications, but taking medication every day can be challenging. That's the truth. So we just have to develop ways in which we can make it easier for our patients, help them with devices that can remind them, and help them to also store this medication.
Okay, thank you so much. And this is very important about these challenges that you have mentioned. And this is one of the very most important reasons why we now have a foundation, the Essential Health for All Foundation. It means we'll be able to handle the essentials around accessibility, affordability, and of course adherence. And I would just want you, I know you are doing a lot to support the foundational activities as far as education is concerned, as far as preventive strategies is concerned. And I know we have an announcement we want our people to know that will be executed in the communities in the next month ahead. You may just want to say something briefly about that.
Yes, so like we rightly spoke about, you need to just check if you have hypertension so that you don't get all these complications, right? So the announcement is that coming May, we have the May Measurement Month, which is an internationally recognized as the month where we would want people to know their numbers. So our aim is that we want you to know your numbers, and by numbers here is that we want you to know your blood pressure, be it normal or abnormal. We want you to know your weight, your height, your BMI, your abdominal circumference, and possibly your blood sugar. The reason why we need you to know your numbers is because many people think that this information is only for their doctors. No, you have to know your numbers so that you know the kinds of things that you need to do, how the lifestyle modifications that you need to make to prevent things like hypertension and other diseases and its complications. So this May, we're going to be running campaigns. Stay tuned. We're going to be making more announcements about where we're going to be running the May measurement campaigns, but we would love to have you there. Please come, get checked. It's going to be for free, and know your numbers, please. As when you're coming, prepare all your questions. You can also ask us questions right here, but I'm sure when you come to know your numbers, it'll be best to even ask us more questions in person. So we look forward to meeting you during the May Measurement Month.
Thank you, Dr. Kimonia Bir. It has been an excellent podcast, and as she has said, know your numbers in May with Essential Health for All Foundation, Essential Health Higher Institute. We are going to be sending into the communities different teams that will be helping you to know your numbers and answering your questions. You are once more welcome. See you in the next podcast. Thank you.
Thank you.